You're watching Local 10, home of Local10.com. WPLG Local 10 News at 5 starts now.
But first, what one local group is doing to help children with special needs and their parents make a very important transition. That's next, right here on Local 10.
More than 10 million children in the U.S. have special health care needs.
And now a South Florida Pediatric intensive care group is working to reduce the time these young patients have to spend in the hospital by helping their parents learn to care for their children at home. Here's Christy Kruger.
Since he was born in February 2011, Colin Guanella has spent much of his life in and out of hospitals. His premature birth, brought on by placental failure, led to a host of health problems, requiring multiple surgeries and a slew of medications.
You walk into the NICU, we used to hold our breath walking in every day because you never knew what was going to happen or what you were going to see, what was going to, this infection today or that, or what went wrong.
From the beginning, the focus was on getting Colin well enough to go home.
It's always a transition. Most families are actually quite scared when they come to the ICU. It's a daunting experience to be here with all of the machines, the beeps, the buzzes, the noises, and the fact that their child is fragile. They're always afraid that they'll do something wrong.
Pediatric Critical Care of South Florida helps families transition from hospital to home through hands-on education.
We teach them about what we're doing. They participate in rounds with us every day. They're allowed to ask questions and be a part of that. We spend bedside time with them to teach them about their child.
In time, parents go from being fearful to fearless, gaining the confidence to do whatever's necessary, even resuscitate their own child.
It seems like something that you would never want to do, but in some of these chronically ill children, it's a reality. It's just what they have to deal with.
Ben and Amanda say being able to help care for Colin at home has made a world of difference in his development.
We are just flying. Grown 6 inches in 6 months. He's just growing. He's doing tremendous.
Now, taking a family-focused approach means parents not only work closely with the staff in the hospital setting, but many times the doctors and the nurses actually go to the family's home to help ease the transition. With your health news, I'm Christy Kruger, Local 10 News.
Christy, thank you. And studies have shown that many children with special needs have a greater chance of advancing physically, emotionally, and mentally in a home setting.